Hi, I'm Aubrey Lisicki, and this is the third part of our introductory lecture series on breast self-care and breast health. In the first part, we learned about breast anatomy and some simple lifestyle changes that you can make to improve your breast health. In the second part, we met Gina and learned some different breast imaging options that she had when her doctor found a lump. Now, in the third part, we will demonstrate a thorough breast self-check using a technique that involves the 6 P's. Those are perimeter, position, palpation, pressure, pattern, and pay attention. Then we will review how to best incorporate breast self-check into your lifestyle, as well as how to optimally include your healthcare team in deciding your best breast cancer detection strategy. I will now take a moment for an important disclaimer. I am not a doctor, and this lecture is not a replacement for a thorough medical examination by a physician. Massage therapists do not perform breast massage to detect cancer, but rather to educate and increase awareness about breast health. Neither mammography, breast self-check, nor clinical breast exam provide a definitive diagnosis of breast cancer. Diagnosis and staging of cancer requires a biopsy. Breast health education is one important piece of an integrative breast cancer detection strategy. You should always discuss your medical concerns with your doctor. Now, I will demonstrate a great technique to do a thorough breast self-check. So today we're going to learn a thorough breast self-check. The method that I use to teach in my clinic is the Mammacare method. I've decided to use this method because the Mammacare company has done extensive research to verify that this is the most accurate and most consistently reproducible way of learning how to do a breast self-check at home. This method involves the 5 P's. We have perimeter, position, palpation, pressure, and pattern. So starting with the first P of perimeter, we want to make sure that we completely palpate the full border of the breast tissue. So this perimeter includes from the border of the clavicle or collarbone, down the sternum or breastbone, to the crease at the bottom of the breast, around the 6th or 7th rib. We'll follow that over to the lateral edge, which is the latissimus dorsi muscle, and into the axilla or armpit as the breast tissue extends into the armpit, finishing back at the end of the clavicle. So as you've noticed, we've changed the position. As you can see, by having the arm over the head, this stretches and opens the breast tissue so it lies flat over the chest wall and makes it easiest to palpate the tissues at all depths. One other thing we'd like to do to further shift the breast tissue on the chest wall is to position the client in a K-hand position. So what you'll want to do is to roll away from me and placing a pillow underneath the body, rolling back. You can see how we have shifted the breast tissue more toward the center of the body. That will make it easier for us to palpate these tissues at the deepest levels. We have the perimeter, we have a correct position, and now we need to learn about palpation. Palpation is to use our hands to explore the quality and texture of the tissue to see if you can find any changes since the last time you did breast self-massage or a breast self-check. We are going to use our 3 fingers and the flats of these 3 fingers, as this is the area that we have the best sensation. The fingers will be placed at the border that you're going to start in. I like to start at the lateral border. And we're going to use different pressures. Some lumps are found at different depths in the breast tissue. The pressure that we use is at 3 different depths. We're going to have a shallow pressure, a medium pressure, and then a deep pressure. So we'll be doing 3 circles at 3 pressures with our 3 fingers. After making those 3 circles, we can step our fingers down and do the same 3 circles, shallow, medium, and deep, stepping down in a straight line. This moves us to pattern, the 5th P in the MamaCare system. As you've noticed, we moved our pattern of checking in a vertical strip. I call it the lawnmower technique because we move down, turn the lawnmower around, and then move up. And as we use this pattern, we can get all the way through the breast tissue in a consistent manner. Once we get to the center of the breast, making sure to also palpate through the 3 layers at the nipple, we're going to change positions. Go ahead and roll away from me and roll back. And at that point now, the breast tissue will shift laterally again. So now we have thinner tissue to work through that's spread more evenly across the chest, and we'll continue our pattern through the medial portion of the breast. Reaching across, doing our 3 circles, deep pressure, and then stepping up, doing shallow, medium, and deep pressure. We will repeat this pattern all the way up to the clavicle or the collarbone, and getting to that point, then step over and moving down, making sure to palpate all the way down the border of the sternum and ending finally at the bottom edge of the breast. Our last movement will be to lower the arm, our final position, and then to palpate across the collarbone, making sure to do a thorough final check along the upper perimeter of the breast tissue. The P that I have added to the technique is pay attention. How you can do that is, as you're going through your breast self-check, you can use a marker or an eyeliner to circle areas that you find to be a little questionable or unusual or something that you did not notice the month before. At that point, you're welcome to take a picture or use a permanent marker to mark the area to take back to your doctor, and then the doctor can examine that area and discuss with you the findings. And if he or she feels like those are findings that need to be taken to a radiologist to do further imaging, or if it's a normal nodularity for your tissues. You can track this throughout the month and see if this tissue changes by using your breast health journal, and bring that information to your doctor so that he can make a more accurate diagnosis as to what your condition is. Now that we have seen a demonstration of the MamaCare method of breast self-check, I would like to discuss 3 questions that I'm frequently asked during breast care education classes and sessions. The first is, what if I have pain while I'm palpating my breasts? The second is, can I perform breast self-check in the shower? And the third is, why do different practitioners in different organizations teach a different pattern of palpation during a breast self-check? It is frequently taught that breast self-exam should not be painful. However, over 70% of women report that they have breast pain at different times in their lives. It is logical to me that at some point a woman would be performing a breast self-check during a time when she has breast pain. It is misleading to tell women that there will not be any pain during palpation, as it may lead them to think that there is something wrong with their breasts if they find a painful area during a breast self-check, or that they are performing the breast self-check inadequately. The reverse is actually true. When women find a lump or bump that is painful, it is most likely that it is a benign finding, whereas breast tumors usually are not painful at all. Fortunately, we have a great, fast breast self-massage protocol that we can use to reduce breast pain. Another issue that is brought to my attention is it okay to perform breast self-check in the shower? I think that not only is this a waste of water, it discourages women from spending an adequate amount of time doing a thorough breast self-check right before they're rushing off to work or to finish their day. Also, the position that you're in while standing in the shower to do a breast self-check is not the optimum position to be in to be able to accurately palpate all the tissues. The third question I'm asked is, why are different palpation patterns taught by different breast cancer organizations? As a healthcare professional, it is frequently taught to use a radial or a circular palpation technique. This works very well when someone is standing over a person and can see what areas they have already palpated. However, when a woman is working on her own breast and cannot see the entire region, it is more consistent and accurate to use a vertical line technique to be sure that you've palpated the whole area. The easiest way for women to learn how to perform breast self-check and to improve their palpation skills is to purchase a silicone breast lump model. The Mamacare company sells these silicone models, and they come with a DVD that describes a thorough breast self-check. I had always taken it for granted that performing breast self-check or breast self-exam was an important part of a breast cancer detection strategy. As I was researching breast massage benefits and breast anatomy, I was shocked to find a study that actually discouraged women from performing breast self-check as they felt it led to an increase in unnecessary biopsies and no improvement in mortality rates. I dived down the PubMed rabbit hole and thoroughly investigated how they came to this conclusion. As I went through these studies, it became apparent to me that what was actually happening is that medical providers and women were not being taught correct and consistent palpation skills. So let's talk now about how we can improve our palpation accuracy. Studies show that 45 to 55% of women find their own breast cancer tumors and bring these to the attention of their doctors. There are other studies that show that many of the breast lumps that women bring into their doctor's visits are found to be benign. How can we improve the accuracy of our breast cancer detection? It starts with becoming familiar with our breasts and the tissue texture changes over time. Performing breast self-massage daily is a great way to check how our breasts are changing on a regular basis. Also, when we perform a breast self-check, we are also manipulating the tissues in a way that is similar to massage. So how can we optimize our routine so that we can have a more accurate and thorough breast self-check? It's not surprising to find that women are only spending 3 to 4 minutes doing a breast self-check if they perform a breast self-check at all. Meanwhile, medical professionals are spending on average 1 to 2 minutes doing a breast exam during a doctor's visit. It is recommended by studies that we spend 5 to 7 minutes doing a breast self-check to perform it with the most accuracy. This translates to about 3 minutes per breast. We should also discuss when do we do a breast self-exam. Typically for a woman who is menstruating, it is important to do the exam during a time of the month when the breasts have the least amount of fluid or swelling. This tends to happen on the 5th or 6th day of the cycle, so this would be at the end of having a period. For women who are postmenopausal or no longer menstruating, it is more important to choose a consistent time each month to perform the self-check, as that will reinforce their learning and accuracy. But by all means, if you miss this time, do your breast self-check anyway, as it's still important to have a regular practice to reinforce your learning. New technologies are available that help us remember all of our appointments, particularly our checkups with our doctors. But what about our appointments with ourselves to remind us to do our breast self-check? Studies done with young women, sending them text reminders and emails, showed that participation in breast self-exam increased by 36%. Putting a reminder on your phone or signing up for an email reminder is a great way to encourage yourself to do a regular breast self-check. Our phones can remind us, but do women remind each other? Women are most successful when working with other women in community. Research has found that when participants talk about their breast self-check habits with their friends and family members, they are more likely to participate consistently in breast self-check as well as their circle of friends. It is one thing to have a demonstration of breast self-check, but it is a different thing to have feedback while practicing this new skill. Studies have also shown that if a woman can receive feedback while practicing both on an idealized model as well as on her own breast, that she will improve the accuracy and be able to find smaller lumps in her breast than she could without this additional practice. This may require purchasing a breast lump model for use at home, in addition to scheduling practice time with a healthcare professional who can tell us if we're doing our palpation correctly. Finally, it is important to reinforce our learning with regular retraining with a healthcare professional. Studies show that our palpation skills will diminish over time if not reinforced with new training and review of our skills. When you're considering who to review these palpation skills with, might I suggest a massage therapist? Body workers spend hundreds of hours studying palpation. A massage therapy session is usually 60 to 90 minutes long in a very relaxed environment. This allows ample time to review your self-check technique as well as learn breast self-massage protocol and to receive therapeutic breast massage to improve the health of your tissues. In the end, none of these practices are useful if we do not track our progress. Pay attention to changes in the texture of your tissues over time. If you find anything unusual during a massage or a self-check, write this down on a calendar or write it down in a journal. Many medical conditions respond favorably when symptoms are tracked and then reported accurately to healthcare professionals. I find it useful to circle the area where I find unusual texture changes so that women can show this to their doctors to see if they require any further investigation. They can also take pictures of these marks so they can monitor how the tissue changes over time and how it might fluctuate with their hormonal cycle or changes in their diet. In conclusion, there are many things that women can do to achieve and maintain optimum breast health. This includes performing breast self-massage daily, making changes in your lifestyle habits such as bra wearing and increasing vitamin D and iodine in your diet. You should also know your breast anatomy. To monitor your breast health, know your breast imaging options and how to discuss this with your healthcare team. And finally, remember to perform thorough breast self-checks every 1 to 2 months. The reason I created this lecture series is to provide women with practical information and simple techniques that they can use for themselves or teach their massage clients. It is my sincere hope that you come away from this series with a sense of less anxiety about breast cancer and a greater sense of empowerment about your breast health. If you are interested in learning more about breast care and therapeutic breast massage, I teach continuing education classes and am available for public speaking engagements, as well as private breast care education sessions. You can reach me at www.breastremediseattle.com.